Getting the correct cervical diagnosis will help the treatment be more effective. Remember cervical spine mechanics while I show you how to test and diagnose the cervical spine. I'm Dr. Bates, and this is Musculoskeletal Minute. To start, we will diagnose the OA. Again, the OA mechanics is rotation and side bending in the opposite direction. So what I do for diagnosis is I have my middle finger on the occipital condyle and pointer finger. I'm feeling the articular pillars of the first cervical vertebrae. There's no transverse process on the first cervical vertebrae, so got to rely on the articular pillars. And ever so slightly with my middle fingers, I lift up on the occipital condyle and then check flexion and extension. And all of this is motion with just my middle finger. And then I'll double check myself. Okay, so she side bends right better than she does side bending left. So she is side bent right and rotated left. We diagnose the AA by relying only on the rotational aspect. Bring the cervical spine up into flexion and then just rotate. With the flexion, it locks out the other cervical vertebrae, so they are not contributing, as 50% of cervical rotation comes from the AA. We can test that. And again, fingers are over cervical vertebrae number 2. Shannon appears to be fairly even with that, maybe a little bit of restriction left, so she is rotated right. To diagnose the remaining cervical vertebrae, pretty easy to just kind of palpate along the articular pillars to see if there's any sort of hang up. And then from there, I usually prefer a little bit of translation. So which side am I feeling the speed bump? I'm feeling a speed bump on the left here, about C5. And I translate to the left and to the right to see which one works easier. And then I'll go ahead and push anteriorly to see which way, just to confirm what I feel. And again, she rotates to the right pretty easy. It's harder to translate left, which indicates a right side bending with that translation. And then at the end, is she flexed or extended? I move superiorly, gets harder, inferiorly easier. So that means that she is in extension there. Now my quick and dirty method for diagnosis is actually rotation to the side and palpate along. And again, I find the same exact spot, but I check the other side, nothing's there. And that is a quick and dirty rotational motion testing, and then just double check with the side bending and good to go with that diagnosis. Thank you for joining us on Musculoskeletal Minute. We have your back. Please remember that this is for education and does not constitute medical advice. Please subscribe, leave us a positive review, and share with your friends.